Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. Earlier in the morning, South Korea confirmed 51 new cases. 31 of them are local transmissions, and most of them are from a new cluster infection at a church here in Seoul. So far, a total of 16 people have been infected from the church. 20 of the new cases were imported, and South Korean health authorities have today once again urged citizens to postpone or cancel face-to-face meetings and small gatherings over the weekend. Now, the country's total caseload stands at 12,653. There were no additional deaths, so the death toll remains at 282. And once again, South Korea confirmed 51 new cases on Saturday. 20 of the 51 cases were imported, and South Korean health authorities once again urged the citizens to refrain from gatherings, small gatherings, including religious ones over the weekend, to prevent further infections. The briefing has just begun, so let's take a listen.
Let us now begin our regular briefing for June 27th on the COVID-19 response here in South Korea. We have 31 new local infections today, and a total of 145 people have been discharged today, and a total of 1,054 people are in quarantine undergoing treatment. Yesterday, we had no additional death toll, and the fatality rate stands at 2.3%. First of all, here are some updates on the details of the domestic infections. At the sport facility in Yangcheon-gu District, Seoul City, we have found through the epidemiological investigation that one more additional case has been confirmed, increasing the total to 73 to date. And related to Wangsung Church in Gwanak-gu District in Seoul, we have 7 more cases, and a total of 19 have been confirmed to date. And we are currently testing all of the church members. Also in Gangnam-gu District in Seoul City, we have 3 more people being confirmed, and increasing the total to 11 as for this small group meeting that happened in Yeoksamdong. And also in Gyeonggi District, we have Anyang City, the God Glory Church. So far, 11 people have been confirmed. And the rest of the church members are being tested. And we're also doing the epidemiological investigation and contact classification as well. And in Gyeonggi-do, Seongnam City, at a Sujeong-gu small group meeting, we had 6 cases being confirmed, and we are doing the epidemiological investigation. And in Gyeonggi-do, Icheon City, at the Kupang Deokpyeong Logistics Center, we have found that out of the 196 contacts who are tested, we had no additional cases. And in Daejeon City, at the Seogu District, at the door-to-door sales facility, we have 3 additional cases, and in total, we have 75 cases being confirmed to date. So these were the domestic infections updates. And yesterday, we had 20 new imported cases. And of the countries, 1 was from America, 3 from Europe, and also 16 were from Asia, excluding China. And in Kyrgyzstan, we had 10 people, Kazakhstan 2 people, and Iraq 2 people, and the rest were others, so amounting to 2. And on July 21st, we found that at a Russian flagship that embarked in the Busan port, we found 2 more additional cases, and the total now stands at 19 confirmed cases to date. Next, we are currently conducting R&D therapeutic treatments for the plasma treatment. And so far, we have 211 people who have agreed to donate their plasma samples for this research. And at the Gyeonggi-do Bundang-gu City, we also have found that 5 of the people who are working in the public health center, they have been confirmed of the COVID-19. However, they have been fully recovered, and they also agreed to donate their samples for our our research. Thank you very much once again. And the KSDC notes that during the weekend, we ask the residents to avoid any religious small group meetings, including church retreats and any other small gatherings. As for religious groups, we ask you to refrain from engaging in joint activities that increase droplet-induced transmission, and we ask you to switch to non-face-to-face methods and cancel or postpone small group meetings and church retreats as well. So this is an urge that we ask the church facilities. And if on-site worship service is held inevitably, we ask you to decrease the number of participants to ensure that participants keep proper distance from each other. And please take measures like checking participants for their fever and other symptoms, and ensure hand washing and mask wearing to all of these people who are at the service. And please do not engage in activities that increase the droplet-induced transmission, such as singing, chanting, or shouting, and eating together. Next, at Ansan City, we have found that we have this infection among the young children who are at the kindergarten. And as of June 16th, we have found that there were suspicious reports of this similar infections. And the KSDC has conducted the epidemiological investigation together with the local government. And today, at 3 p.m., we will have a related meeting and we will discuss the updates of our findings. And so far, we have conducted our testings for all of the students, their families, and the faculty members. And as for this test, we have found that out of the 202 people, 111 people have found to have symptoms. And also, we found that among the family contacts, 57 of the family members of these students and faculty members has been classified as patients of this infection. And currently, we have 22 people in hospital, and 20 of them are children that are from the kindergarten, and 2 of them are family members. And we have found a serious level of the infection diseases, and out of these students who are undergoing intensive treatment, we are seeing if there are any progress in their conditions. And in order to prevent these infections, we ask you to take care of your personal hygiene measures, including washing of your hands, and please take precautions measures as you eat, and please take care of cooking well, and also sterilize and clean the kitchen area as well as the dinnerwares as well. And please also, we ask for those who cook these meals to take extra precaution. Last but not least, related to COVID-19, we have a last message to the public. Currently, the COVID-19 pandemic is occurring at a lot of countries, and a lot of the countries are going through coercive lockdowns. However, now they are easing their lockdowns and returning back to a normal. However, we are at the beginning of a possible second wave, so it is very difficult for us. And also, if you just look at the U.S., we have over 400,000 people being confirmed on a daily basis. And in Europe as well, we have a high number of daily cases there as well. And we are concerned that these could be a possible second wave. And in these countries, we also witness new cluster infections. And many of these countries are considering whether to put an intensive lockdown once again. So a lot of the countries are being extra cautious and concerned. And if we look at the reasons and causes of these once again, we need to also acknowledge the fact that we are living a new normality in the COVID-19 era. However, we believe that there are some lacks when it comes to our implementations of these acknowledgements in our daily lives. So in other words, months, it means that if the COVID-19 number dwindles, we also are misled to think that we can go back to new normality. So I believe that we are less dedicated to a change in our new life system. And a lot of the experts have said that of course, the health and social sectors, but also the travel, holidays, as well as transportation, security, media, and many all other sectors are changing, and they're prone to change in the future as well. And individual daily lives, as well as business activities at business establishments, and the services at restaurants, and physical contact in sales, we believe that all of these forms will be transformed and need to be transformed significantly in the future. And going forward, we believe that only the groups and the venues that have good quarantine measures will be selected by the public. And we believe that the society as a whole is changing while it could take more time. During the weekend, we ask you to reduce your activities, and if you need to engage in outdoor activities, please start refraining to going to multi-use facilities, and be careful of possible second wave in the infections, and please comply with the distancing measures and the quarantine measures as well. And please check if the facilities that you are about to go has effective implementation of the QR code visitor log. We believe these very small steps could indeed make a big difference in the future. Despite the COVID-19 pandemic going forward, if we continue to keep our distancing and life quarantine measures, we believe we can protect ourselves from the virus. Thank you very much.
There you have it. We'll bring you more details on the briefing in our upcoming 6 p.m. regular newscast. Until then, goodbye.
As COVID-19 continues to spread around the world, many countries are imposing entry bans on foreign